Good afternoon, everybody, and welcome to the annual general meeting of NHS West Yorkshire Integrated Care Board, the ICB. My name is Cathy Elliott. I am Chair of the Integrated Care Board and Deputy Chair of our Health and Care Partnership here in West Yorkshire. Welcome to Bradford. We have board colleagues around the table here today for our first annual general meeting, and welcome to our visitors as well who have come to join us today to hear about our work. We're grateful to you for your interest and your time today. So we have a standard annual general meeting in some ways, but I'm going to invite senior colleagues to come and share their thoughts and some points of review for us over the last 12 months and looking ahead. What you'll see behind you, if you're in the room here in Bradford, is a slide deck. What you'll see online is that slide deck for your information, and variety of information, including our annual report, is available online for you. So, for people watching online and people in the room, there are name plates in front, and any colleague that is speaking, please would you introduce yourself at that moment? That'd be really helpful. Can I just ask, as a matter of good practice, are there any declarations of interest in relation to today's agenda for the annual general meeting? So I'm now going to pass on to our business that we have on our agenda today. I'm just going to ask again any declarations of interest as a matter of business. No? Okay. We are now going to hear from Rob, our Chief Exec, on reflections of our first year as a statutory organisation under the Health and Care Act. We became an integrated care board on the 1st of July last year, but very much for us as a well-established healthcare system, working together in partnership for integrated care, we were building on 5-6 years or so of partnership working and very much being a true partnership. So Rob, I'm going to hand over to you, reflections on the last 12 months.
Thanks, Cathy. Just check everyone can hear okay. Thank you very much. Hello, my name's Rob. I'm the Chief Executive. I'm going to speak for a little bit, not cover too much, and then I've got some colleagues who will also provide some reflections on quality and money and some of those issues. We are an integrated care board, which is an organisation which sits within a system. As Cathy says, that system began to work in this way in 2016. So some of the partners around the table from local government, the NHS, the third sector and our communities play a vital role in the governance of this organisation because we recognise that we sit at the heart of a system. You can look at our annual report and annual accounts, and it's full of a significant amount of positive work, and it also reflects some of the challenges that we've faced over the last year. I just wanted to pull out a few things which is important for us to clock, I think, in our first year. We have set up as a statutory body, and I don't normally start with structure, but let's do a bit of structure because it's important to recognise that this organisation was created on the 1st of July. It was previously intended to be created on the 1st of April. So I just wanted to start by thanking all of our clinical commissioning group colleagues for continuing to deliver their services and oversight through CCGs until the 1st of July, and for creating the accounts that they had to for the first quarter to meet the statutory duties that they had until the 1st of July. So when we became a statutory body on the 1st of July, we did so with following a substantial amount of work to ensure that all of the functions of clinical commissioning groups and all of the things that we want to do as a partnership were embedded in the Constitution, were embedded in our values and behaviours, and were embedded in our priorities for this year. And it's important to recognise that. And in doing so, to recognise that the Integrated Care Board is not a big CCG. I know that there are some people around who automatically think because we've picked up the functions of CCGs, that the Integrated Care Board is like a big CCG. It is not a big CCG. The Integrated Care Board sits at the heart of a partnership and is a novel organisation which brings together the third sector, communities, the NHS and local government in pursuit of improving outcomes for local people. So I'm really pleased that we were able to create an organisation that held on to the values and principles that we have as a system and sits at the heart of a system which has an integrated care partnership overseeing it, and it delivers services through places in partnership with providers. That's why we have the board that we do, which also has voices from the third sector and communities around the table. And I just pay tribute to Cathy and her leadership as the chair in making sure that that was the case, and in helping to co-produce the governance that we have. So given that we set this organisation up, it's got 4 statutory responsibilities. You know, making sure that we reduce health inequalities, managing unwarranted variations in care, making sure that we use our resources wisely, and delivering the biggest possible return that we can on the investments that we receive, or the investment that we make, the £5 billion a year that we spend. And the annual report draws out some of the substantial work that we've done in each of those places. You could be drawn, for example, to the work that we've done with our Health Inequalities Academy, which recognises that we know that people with learning disability, people with mental illness, people who live in deprived populations, and people from the global majority have poorer outcomes and poorer experiences of healthcare. What we need to do is to make sure we're doing something about it. So a Health Inequalities Academy that draws on the best evidence and insight, that then looks at what capacity is required to make the change from where we want to be to where we want to go, and then make sure that we have the capability to deliver that through our public health colleagues, through professionals, through the development of a range of health inequalities fellows, is part of the answer to how we address health inequalities. You could be drawn to that or any number of bits of work. On tackling unwarranted variations in care, it's really brilliant to see the continued work that we've done as an anti-racist system and an anti-racist organisation to address systemic racism in communities and within the health and care system, so that we ensure that people from black origins, for example, are not sectioned disproportionately, to make sure that people from different backgrounds have good access to healthcare, to vaccinations, to clinically competent staff. On making sure that we use our resources wisely, there's a huge amount in there around our accounts. I'll leave Jonathan, the Director of Finance, to give you an update on that. But you'll notice that we met our statutory responsibilities on the money. And we also continued to allocate the money to places to be spent by the places with their partners, because they've got the greatest degree of insight around where the money should be invested to make the biggest difference possible. And on the biggest impact on the investments that we'd make, you know, I would ask anybody to go and visit Red Kite View to see the excellent standard of care that's delivered for children who require a hospital inpatient stay because they're mentally unwell. But the staff there, you may not realise, are being drawn from the local streets, because we recruited from local communities who face significant inequity because of deprivation, because that's one of the ways that we make the biggest difference that we can. And those sorts of initiatives are littered throughout our people plan, which Kate Sims has helped helm and implement throughout this year. So those 4 statutory responsibilities, we've continued to see at the heart of what we do. They're reflecting our 10 big ambitions and in all of the work, and you can see them shot throughout the annual report. If we reflect on the last year, I think we would all recognise that it's been really tough. So between July and March 2023, I think we'd all recognise we faced professionally the toughest winter that any of us have faced before in our careers. We had significant and substantial delays in delivering care. We had significant and substantial disruptions to care, driven by a confluence of diseases which came at the same time. So we had COVID-19, flu, strep A, and various other respiratory illnesses, all apparent at the same time, which had a devastating effect on our ability to deliver care. The good thing is that because we have a strong system built on places with providers in collaboration, the response to that which is reflected in the annual report, was to work together to mitigate the risks and ensure that safe services could be delivered wherever possible. And it's testimony, I think, to the strength of the partnership that that's what we did. And in March, we came together to review the winter and see how that had felt for everybody. And when we talk about winter planning in the board meeting later today, the planning for this winter started in March this year, because that's the kind of partnership that we are. So I think it's worth reflecting that it's been an incredibly difficult year because of a range of factors and because of industrial action. We now find ourselves in a situation where a significant part of our workforce has been in dispute with the government for a significant part of the period in question. We're currently facing industrial action this week, which continues with the doctors, and our medical director, Dr. James Thomas, is the director dealing with that today, which is why he isn't in the annual general meeting. That industrial action and that fracture of the relationship between our staff and the government needs to be sorted, because we can't deliver recovery, we can't deliver productivity, we can't deliver safe services all of the time if we don't have our staff and our people on board. So that's another reason why things were quite challenging, and a resolution, unfortunately, is outside of our hands and needs to be dealt with by people outside of this room. And I would urge them to do that as a matter of significant importance. There have been a range of really brilliant things happen this year, and you'd be forgiven for thinking that wasn't possible if you just stuck to reading the newspaper or think pieces. But in the annual report, you can see that progress, despite all the challenges, substantial progress was made on reducing and eliminating very long waiters. That our prioritisation of cancer continued to make sure that we were reducing the backlog for cancer treatments and delivering just about or delivering the standards in cancer services. And that in a range of services we were implementing changes which join up care and deliver better outcomes for people. And the last thing I'll say about the annual report is it does reflect something that I think everyone around the table understands, and something we all firmly believe in, that the organisation and the system is made of people. It's the people that we work with, it's the people who deliver care, it's the people who they deliver care to. As we heard this morning, it's the peer support from people who have the same issue as you in our communities that really drive improvements in healthcare and keep people well. And our people plan as fundamental to delivering safe services, high quality services, financial balance, and meeting our 4 statutory responsibilities as money. And we need to continue to see that. So that was what I wanted to say about the annual report and the accounts, and I'm going to hand over, I think, to Beth now.
Is it on? Oh, yeah. Hello. Hello, my name is Beverly Geary. I'm Director of Nursing for West Yorkshire ICB. I'm just going to share with you a couple of things. I'm going to repeat some of the things that you've said, actually, Rob, but through a quality lens as opposed to a performance lens. And also, if we think about impact on patients, I'd ask people to think about that while I talk about cancer and industrial action, etc. So I think in terms of our achievements from a quality and safety perspective, West Yorkshire remains one of the best performing systems on progress to improve access to cancer services. And that's, recovering from backlogs that were caused by the pandemic. Our 28-day faster diagnosis standard, we're achieving 78% against a standard of 75%. As a system, our 31-day first treatment standard, we're achieving 94% against a 96% standard, but Airedale and CHFT are exceeding this. So that's really good news for patients. In terms of our 62 referral to treatment standard, we're achieving 68%. The expectation is that we'll achieve 70% by March 24, which given that demand is increased by 8%, again, that's really good news for patients. So as I've said, we are one of the best performing ICBs in the country, and that's to be celebrated for our patients at these times. I'm going to go back to winter, even though we are going to talk about winter this afternoon. And as Rob said, we've been planning for winter since March, so we're barely out of last winter, which, as Rob said, was probably the worst that we've ever experienced in the NHS, certainly in my experience. And what I want to say that as a system, we managed the unprecedented demand and avoided any declaration of major incident and any adverse harm to patients as a result of the EPRR arrangements and our system ways of working. So people in all organisations across West Yorkshire and the ICB came together to ensure that our patients were safe and well cared for in this really, really difficult time. And we hope to take some of the learning from last year and bring it into next winter, whilst praying that it won't be as bad as the last one. In addition, again, as Rob said, we've seen some real challenges in relation to strike action, not just for patients and cancellations of appointments, but also for our teams in provider organisations and also at system level. And again, through our really good ways of working in West Yorkshire and via our EPRR arrangements, we've successfully managed these without incident thus far. And going forward, we're going to be one of 5 systems in the country to look at potential harm for patients that have been experiencing longer waits. So I'm sure that at the future board meetings we'll be bringing some of those findings back. But that's a national piece of work that we've been invited to participate in. Finally, and I think given that this is, we talk about maternity services a lot. I am privileged to be part of the LNMS, so the local neonatal and midwifery system. And we've been working in a really difficult context over the last 12 to 18 months, maybe even longer than that. And that's on the back of the Donna Ockenden report and also the Bill Kirkup report. And our LNMS have come together to share best practice. And we've seen some really positive results. And our CQC ratings for some of our services a testament to that hard work, where we've seen an increase in ratings of safe in some of our organisations and also well-led. We are not resting on our laurels, however. We've got peer reviews that are planned in the coming months. So November and December, every one of our our maternity units will be visited by a delegation of professionals from across the system to offer support, peer learning and challenge to ensure that our safe systems of working and our safe services continue. I'm going to leave it there, Chair, for the moment. Thank you.
Thank you very much. That's an incredibly helpful update. As part of our standard annual general meeting, we'll hear now from our Director of Finance, which relates to our annual report, which I mentioned earlier is online alongside our accounts. So, Jonathan, over to you.
Thank you, Chair. So I'm Jonathan Webb, Director of Finance. I just want to give a brief overview of the first set of accounts for the ICB, which covers the period from 1st of July 2022 to the 31st of March 2023. What's always been really important in West Yorkshire, indeed for this board, is that we look at financial position both for the ICB and also for the system. So in lay language, what that means is looking at the ICB's position for the statutory organisation plus the 10 NHS providers based in West Yorkshire. So we've got the ICB position and the ICS position. For the ICB, we started the year with a plan to deliver a surplus of £4.4 million. That's on a total annual allocation of £5 billion. That £4.4 million small surplus was matched with an equal and opposite deficit in provider plans. So as a system, we started the year with a balanced financial plan. So we were planning to spend all of the money allocated to us in West Yorkshire for the benefits of our population in West Yorkshire. The overall position that we finished the year with was a £0.8 million surplus across the system. 0.2 of that sat in the ICB and the balance sat in providers. Clearly £0.8 million is an awful lot of money, but it does need to be set in the context of an overall allocation of £5 billion. In terms of the ICB itself, we met our 3 statutory duties. So we didn't breach our revenue resource limit. We also managed our capital expenditure within nationally prescribed limits, and we didn't exceed our expenditure on running costs. So those three statutory duties that we met. We also produced a set of accounts that were deemed as unqualified by our external auditors, i.e. a clean set of accounts. And we also obtained, in our first year as an ICB, a positive value for money opinion from the external auditors, which suggests that we are spending our resources in a way that maximises the benefit for our patients and our population. In this slide pack that I think is available on the website, there's further information about where the money in West Yorkshire goes across our various programme areas, which some colleagues may find useful to look at. So the slide packs will be on the website. There is also more of a summary narrative about our financial performance in the year contained in the annual report, and the full set of accounts are also available as part of that document. Thank you.
Thank you very much, Jonathan. And we know a point from Rob earlier is that we have 9 months of accounts just to the nature of the way in which we were set up under the Health and Care Act last year. Okay. Colleagues, thank you so much for those overviews. It's really, really welcomed. I think we're very proud of what we've achieved in the last 9 to 12 months as a board, as a senior team, as a partnership board. And thank you to Rob and senior leaders for making this happen. It's been a huge amount of work and it's been a challenging year. And we're about to go into another one, aren't we? Rob, we just wanted to invite you to give some reflections on the year ahead. I think you've started to hint at that. And for board colleagues around the table for the rest of the afternoon, we'll be coming back to this and making sure we've got foresight. But I think for members of the public and anyone watching online, I think it'd be helpful to hear from you.
Thank you. So in terms of the year ahead, it's worth reflecting on a few things which are real and present and will be in discussion about in the board this afternoon, and we've been in discussion about every board meeting, I think. And as an organisation supporting the system, we deal with things on a daily basis. You know, James is back in the room now, but he's just been dealing with daily operational matters. But we also have the privilege of looking to the future, because we've got to, because we can't be in this position all of the time in terms of the way that services are delivering today. We've heard this morning in our structured engagement session of some of the changes that are required to bring together mental, physical and social support for people in our communities, for example. So this year, I think we've got to recognise that the context continues to require us to be agile and to act. So the last few weeks, we've had two very shocking things happen. So we've had a serial killer operating in the health system who's been prosecuted, where the prosecution and the trial and the verdict has opened up a significant and substantial conversation about the culture in the NHS and the culture of speaking up and the culture of safety. We've also had an equally shocking piece of research which suggests that women in surgery are subject to, 2/3 of women in surgery are subject to sexual harassment in 2023, which is disgraceful. And these revelations are the kind of things which come along we have to respond to. It's easy to react to, but we have to respond to in a thoughtful and impactful way so that we have the right culture where people feel they can speak up, where issues get addressed when they're raised, where people are thanked for raising concerns, which is what we espouse. And we have to look at ourselves and see, is that the reality for people right across the system? And where we collectively ask ourselves questions about what does the sexual harassment in surgery say about the rest of the system? Is it the only place, or is it happening in other places too? And we need to make sure that we're addressing those. So that kind of context does shape what we do. It also is part of a broader context, which includes, you know, the continuation of the cost of living crisis, the continuation of living with COVID-19, and the continuation of the need to address substantial inequity and inequality in each of our communities. So for the year ahead, we've got slightly changing context, but our priorities remain. And the great thing about this year is we've taken the opportunity to refresh our strategy. We've done that with people from right across West Yorkshire at all levels, engaging and co-producing something which will set our trajectory for the next 5 years. We've backed that with a joint forward plan that says it's all right to have a 5-year look, but we need to make progress. Real change happens in real work. So these are the things we will prioritise. And we will continue to focus on our 10 big ambitions around healthy life expectancy, the life expectancy of people with mental illness and a learning disability, supporting children in poverty, early detection of cancer, suicide prevention, antimicrobial resistance, maternal mortality, having a representative leadership, making sure our contribution to the economy is understood, and doing something about climate change. At the same time, there are national priorities which are the same as local priorities. People want to see their GP. There are national standards around that. People want to be seen quickly in A&E. There are national standards around that. People want access to a dentistry. There aren't any national standards for that, so we've created some. We need to focus on those things too, and we will. And as we go into winter, I think we're incredibly well prepared. As I said earlier, we're hoping for an end to the industrial action, which brings greater risk to patients and greater moral injury to our staff. Because without an end to that, things will be even more difficult. So I'm happy and content, I think, that we are doing the right kind of work together in the coming months. I must also reflect that our organisation, I started with structure, I should end with structure, even though it's not the thing that makes the difference to delivery. Our organisation is going through a substantial restructuring on the back of the requirement to reduce running costs by 30%. We start our consultation with our staff on the 26th of September, which will lead to a number of reductions in posts, and we're trying to make sure it doesn't distract us from the work that we've got to do, which is aimed at delivering improved outcomes for local people. Thank you.
Thank you very much, Rob. So that brings to a close our annual general meeting. We haven't had any questions from members of the public submitted in advance. If members of the public do have any specific questions in relation to the AGM and the documents online, please contact us through our corporate governance team and we'll provide a response. And in about 5-10 minutes time, we'll then move into our board meeting in public, and we do have some questions that have been submitted in advance that we can then provide responses to. And Shelley, your question is noted and we will provide a response to you. Thank you. Shelley, let me just finish the meeting and then I'll come back to you in a moment. Thank you. So, colleagues, that is the end of our annual general meeting. Thank you for everyone here who's gathered today in Bradford. We appreciate it to reflect on the last 12 months. We are now going to bring that meeting to a close and we will come back together at around, let's say, 1:15. 1:10, Laura corrects me, to then start our November board meeting in public. Thank you very much, everybody. Thank you.